Anyways, in this session, we'll continue with what we did in the last one. So we'll continue from T3 suppression test. Right. So this test is conducted after 24 hours of radioiodine uptake studies and obtaining the basal value and serum T4 values. So 20 microgram of T3 four times a day, 4 times daily is given to the patient for 7 to 10 days. Or alternatively, 25 micrograms 3 times a day for 7 days is given to the patient. So radioiodine uptake is repeated after T3 administration and serum T4 values are also determined. A suppression in T3 production is indicated by 24 hours RIU falling to less than 50% of the initial uptake by the gland and total T4 of approximately 2 microgram per 100 ml or less. Okay, we are checking by giving an additional T3 into the blood. We are checking the ability of the thyroid gland to identify and suppress its production of T3 levels. If it is functionally doing this negative feedback mechanism, which is being checked. If T3 levels are very high, the thyroid does not require to produce any more T3. Okay, so that functioning is where what we are checking here to see. We give a artificial external T3 to the patient and see if that suppresses the T3 production within the thyroid gland. So no suppression indicates autonomous thyroid function. In Graves' disease, no change is seen, it remains same. Okay, so it's mainly to check the normal functioning it is done. So there are many disorders of thyroid glands where the variation will be there, but this test is done to check what normally is happening within the thyroid glands. Next is THS stimulation test. Now THS is a hormone which is produced by anterior pituitary. Okay, so the role of TSH is very simple. It is going to act on thyroid glands and stimulate production of thyroid hormones. That's why it's called as thyroid stimulating hormone. Okay, so what we do here is try to use TSH and check the stimulation of thyroid glands. How thyroid glands are behaving to the additional TSH that is given to the patient. Now this is done after completing 24 hours the radioiodine uptake studies. 3 injection of TSH is given, each containing 5 USP units. 24 hours. In 24 hours, 3 is given. So sorry, in 24 hours interval, 3 injection is given. That means this is going to continue for 3 days. Okay. After that, 24-hour thyroid RIU is measured after 42 hours and after the final dose of TSH. Now, let us understand the methodology first. It's very simple. An external TSH is given, 5 USP is the unit, and given every 24 hours for 3 days. And after 24 hours of injection, okay, thyroid iodine uptake is measured. So that means that it will be measured after 24 hours, after 48 hours, and after 72 hours of the TSH dosages. Okay, so see if this is having an effect on stimulation or not. Next is TRH stimulation, thyroid releasing hormones stimulation. Now this is for assessing the location of site of lesions if there is present in hypothyroid states. This test is only done to confirm the hypothyroid state and to locate the lesion if it is present in the thyroid gland. 200 to 400 microgram of TRH is administered intravenously into the patient. Blood samples are collected at 0, that means before the injection, after 20 minutes, 40 minutes and 60 minutes, and they are analyzed for TSH content. Okay, normal condition is seen when about 4 times elevation of TSH levels can be seen at 20 and 40 minute interval as compared to basal TSH level. The sample that we collect at 0 minutes, that acts as our basal or it acts as our control limit. So we compare the values that we get at 20, 40 and 60 minutes and compare it with the basal, and we see if there is a normal level or not. A normal functioning thyroid gland is considered when we have 4 times the value. Let's say at 0 sample we got 10, okay, 10 microgram. We see at 20 to 40 it should be around 40 or 50. There was a 4-time increase is seen in normal conditions. Exaggerated and prolonged response indicates primary hyperthyroidism, or the level starts to increase after that 40-minute interval sample. Then it can be said to primary hyperthyroidism. A blunted response indicates secondary hyperthyroidism. Delayed tertiary hypothyroidism can be seen if the origin of the lesion is in hypothalamic region. Okay, so till here we are only focusing on knowing the test. Okay, yes, we will be now looking into the test that measure blood levels of thyroid hormones. Okay, the T3, T4, TSH, total T3 and free thyroid hormones. So these are the following tests that we are going to do in this topic: serum T3 levels, serum T4 levels, and serum TSH levels. Now this includes both free T3, free T4, and total T3 and total T4. Now the concept, let us understand what is the difference between free thyroid hormone and total thyroid hormone. Now these thyroid hormones are bound to a protein called as thyroglobulin or thyroglobin. Okay, so once these are bound, they fall under total T3 where they are functional. Okay, free T3 means the thyroid hormone T3 hormone is not bound to thyroglobin. Okay, hormone bound to thyroglobin is comes under total. Thyroid hormone not bound to thyroglobin comes under free thyroid hormone. So that is the difference. The more free thyroid hormones it is there, the more functional the hormones will be. So whenever we are doing this test, we don't solely rely our diagnosis on T3, total T3 and total T4 levels. Our diagnosis also goes into free T3 and free T4 levels. So the significance of measuring free T3 and free T4 has come into the light in the recent years. It's a new concept. However, it plays a very important role in diagnosis and increases the accuracy of diagnosis of thyroid diseases based on measurement of thyroid hormones. Okay, so in this slide, what we are going to do is we are going to see the parameters. We will see the normal range, and we will see where and which values should we take to assess either the patient is in hypothyroidism or hyperthyroidism. Okay, we'll start with serum T4 values. This is total T4. So normally it should range within blood between 4 to 11 microgram per DL. Okay, so that is a normal range of serum T4. Any values less than 2.5 microgram per DL indicates that the thyroid function is below normal. Okay, so it indicates hypothyroidism. Similarly, a values more than 12 microgram per DL indicates hyperthyroidism. Let me repeat, serum T4 value should range normally between 4 to 11 microgram per DL. A value of less than 2.5 indicates hypothyroidism. A value of more than 12 indicates hyperthyroidism. So T4 itself is not very significant. However, serum T3 is more important for diagnosis of hypothyroidism compared to other thyroid hormones. So if you want to base your diagnosis on thyroid hormones to check hypothyroidism, then your focus should be on T3 values. Normally, it will be between 100 to 250 microgram per DL. A value of less than 100 indicates hypothyroidism. A value of anything more than 350 indicates hyperthyroidism. If you compare T3 and T4, you can see there is a change in the concentration. T3 will be normally on the higher side than T4. Because of this reason, T3 plays a more important role in diagnosing decreased function of thyroid glands because it has a very broad range, 100 to 250 compared to T4, which is quite narrow, 4 to 11. Okay, so we use T4 values to check for hyperthyroidism or base our diagnosis of hyperthyroidism on T4 more than T3, and we base our diagnosis of hypothyroidism on T3 compared to T4. Why? Because of the broad normal range, the higher concentration of T3 in the blood. But if you want to assess the thyroid functions in a more sensitive manner, serum TSH plays a very important role. Okay, so serum TSH normally will range from 3 to 30 micro units per milliliter. Anything more than 30 indicates hypothyroidism. Anything less than 30 indicates hyper. Less than 3 indicates hyperthyroidism. Now let us understand why it is ulta. Okay, TSH is responsible for increasing T3 and T4 levels. So that is the function of TSH. If the thyroids are producing enough hormones or normal hormones, or there is normothyroidism, then TSH levels will remain within this range, 3 to 30. If the thyroid functions are not enough or it's not producing enough hormones, more and more TSH will be released to increase the stimulation of the thyroid gland. So a higher value of TSH indicates hypothyroidism. A lower value of TSH indicates hyperthyroidism, in which case there is enough T3 and T4 already in the circulating blood. So the production of TSH will be reduced. So there is an inversely proportional relationship between TSH and diagnosis of thyroid gland compared to T3 and T4. I hope you have understood.